We're going to move on from blood work and talk a little bit about BodyView MRI. So the question that we're going to pose is, if blood work tells us what's happening chemically, right, what reveals what's happening structurally inside the body? I think I want to help viewers understand that imaging just reveals a different reality, right? Which is structural versus blood work is physiological. Teresa, I'm going to ask you this question first because you've been a little bit closer to BodyView than Kevin has. If a particular patient's blood work is normal, right, can they still have something going on inside their body?
Yeah, absolutely.
What kind of things have you seen people come in talking about BodyView or curious about BodyView? What kind of questions do they ask you? Because you're kind of the first line of defense, right? They're usually the first person they're speaking to before they talk to Kevin or talk to me.
Yeah. A big one, which I think ties into the blood work being a snapshot. A lot of people have that thought, if I'm healthy, what's the point of me doing this? If there's nothing wrong, what's the point of me doing this? There's a lot that goes into it. Does your family have any medical history of a condition, of a cancer that you want to stay on top of, you want to start scanning for and kind of keeping a closer eye on sooner rather than later? Is there something personal that you have that blood work isn't giving you an answer? Is it something where we do have to look somewhere else to try to see what is going on? Because I'm a firm believer everybody knows their body better than anybody else on this planet. And a lot of these body views are, I've done blood work, I've done this, I've done that, something is off. I don't feel right, something is off. And it's just an extra step into getting a deeper diagnostic.
Yeah.
But I think most of the time people are wondering, if I feel healthy, if I don't deal with sickness on a day-to-day basis, what's the point of me doing this MRI?
Yeah. And well, on the other hand, if they are, healthy and adamant and like, hey, I feel pretty normal, the reason typically stems from, I had a family member who just had a devastating diagnosis. They were healthy, right? What maybe I'm not as healthy as I really think I am, and maybe the blood work isn't giving me the whole picture. We've had a ton of patients do full body MRI, right? And what's the most surprising thing that you found kind of on the back end after patients are going through it? Like, what are they experiencing, right? Whether there's a finding or not, like what's the kind of general consensus? Because you've talked to a lot of them after the scan as well.
Yeah.
Like what are they usually saying to you after the scan?
I think it's whether there was a finding or not, it's the peace of mind. Yeah. It's people catching things when they're curable or when they're able to kind of look into something deeper. We had a client, she was in her mid-30s, healthy, fit. She wasn't even doing one. Her husband ended up doing one. And she was like, oh my gosh, you get great information. Like, I want to do one of these just to kind of have a baseline, was her word exactly.
Yeah.
And she was a mess. Her reproductive system was a mess. Our internal medicine doctor, it was like, he's like, I need to talk to her now. Like, we're talking necrosis, it was crazy. And she's like, I am asymptomatic. I work out. You could physically see that she was fit.
Yeah.
And I remember, I just got goosebumps. I remember she called me a few weeks later and she was saying she was so grateful. And she's not far from my age.
Yeah.
And to talk to her and see her and listen to her lifestyle, you'd be like, she's healthy as a horse. And she was almost in tears that she had an answer that she wasn't even looking for. Yeah. So I think that people, whether they go into it hoping that they find an answer for something or just kind of peace of mind, hey, I'm in, my 30s and I just kind of want to start and have a baseline, and then something an abnormality does show up. Either way, you kind of have a game plan or you have a breath of fresh air and you have peace of mind. But I hear that with almost every single client is, I found something, I know where to start, or I can calm down and know that I don't have anything deeper going on right now.
Yeah. Admittedly, I'll speak for myself. I went into that scan thinking it's just going to tell me that I'm normal, right? Like, I'm 40 years old, healthy, exercise. And while there's nothing, devastating or very alarming, there was some early indications and structural assessments that indicated hey, Blake, you got some risk in a couple areas that, again, no symptoms, you're fine now, but 20, 30 years from now, this may show up as a problem. Again, in my opinion, that's where real preventive medicine starts.
Absolutely.
Otherwise, do I have the family history? Right? Yes. But again, that's, you know, my grandmother on this side had this, my grandmother on that side had that. Like that's a quarter of my genetics, and who knows if I got that exact gene. So to see structurally, like some of those genetic predispositions that you have are actually already manifesting or in the early stages of manifestation, like now I can actually be preventive. And before I have a single symptom in 20, 25 years, I'm changing lifestyle, changing what I'm eating, you know, the way I'm exercising, the supplements I'm taking. Like I wasn't a big supplement person until I went through all the diagnostics. I was like, you know, I don't know. But then after understanding like how each of those things is contributing to, again, I'm not going to feel any different from these supplements, but if it's helping me 20 years down the road, like
you're putting you're depositing credit into an account, you know, that you're going to draw from decades from.
And admittedly, it's difficult, right? Like I think we're all susceptible to that, you know, mindset of like, all right, I started something, like I don't feel different. What's going, like, is this working? Is it not? But having the clarity and the visibility and just that understanding of like, hey, this is like, is it good for us to take fish oil? Yeah, everybody should take fish oil. It's good for you, right? But to understand specifically for my body how it's helping and why it's important keeps me more accountable. I'm like, do I want to take 5 supplement pills every morning? No, but I'm like, that one, it's important, right? I'm gonna be glad I did this in 20 years, which is really cool. Kevin, you're a little bit farther away from BodyView. You're not as heavily involved as Teresa or I are, but I'd love to hear, dealing with patients more on just the functional side with the genetics and the blood work and things of that nature. Where do you see this fitting in? Where do you see BodyView fitting into your equation?
So number one, I mean, there are, and the technology is advancing, and they are, you know, coming out with more exact ways to test the blood and your DNA to see your risk of developing certain types of cancers. But you know, like we talk about with all of our clients, the BodyView MRI is going to be your best way to rule out any type of growth in that, you know, any type of cancerous growth. So we're looking at, in optimizing your health, we're looking at the largest risk factors first, obviously. And if you have cancer growing in your body, that's obviously going to be the most important thing to attack at that moment as far as your health. I think the BodyView MRI, along with, you know, things like the functional DNA and biological age testing, it does, like you said, with your own experience, it gives you a heads up of what may happen in the future if nothing is done. You know, if you don't make any lifestyle changes. So it's kind of like a certain ship and an iceberg. And if you were able to start changing the direction of the ship much earlier in time,
be easier to dodge the iceberg.
You can dodge the iceberg. But if you try to start changing that direction when you're right on top of the iceberg, it's going to be very hard. So again, with your supplement, you know, the information that you shared about the supplements that you're using and this, that, and the other, a lot of the anti-aging and optimization and longevity therapies or things that people are adding to their regimens aren't necessarily going to be for something to happen, but they are being used so that down the line something does not happen. So it is hard to sell that, because in our society we buy things and we want, you know, instant. We want to see some effect. We want to see some, you know, change. We want to see, you know, we want to get what we feel our money's worth out of it. But a lot of the time, yes, with the BodyView MRI, it can provide peace of mind. We have had clients that come in, do the BodyView, nothing is found. You are completely healthy. Everything inside of you looks great. A+, flying colors. And then they will be upset and say, well, what did I waste my money on this for?
That's what you wanted. That's,
right.
And I actually,
no answer is an answer.
Right.
and I actually made it a point when I'm talking to people on the phone who are considering it. I'm like, hey, when you do the scan, best case scenario is clean bill of health. We don't find anything, right? Because it's almost like you have to prepare people for like, we want to look, we want to know in the case there is something. But also I think it's important, like, again, if I could give people that are considering this like one tidbit or one takeaway, it's like you're going to probably find something out structurally about your body that you didn't know that is, again, maybe early warning signs of a risk factor. And I haven't heard of a patient that hasn't had that experience yet.
Yeah, I'm glad that you said that because I was thinking the same thing. And not all of these abnormalities or results that come back are cancerous or some big, huge condition, but we've had one single body view that even Dr. Fabian, he was like, this is the cleanest thing I've ever seen. He was 18 years old.
Yeah.
So we've scanned anywhere from 18 to 89. I've never seen a report where they're not getting some kind of information from it.
No.
And that could be inflammation. That could be a benign cyst. It could be, hey, this is looking a little off. Just keep a close eye on it, you know, kind of thing. But you are getting a boatload of information from it. And again, a game plan moving forward. If it was spots on your liver, keep a closer eye on your liver, you know?
Yeah, so I had the very small cyst on the pancreas, which thank God it was a cyst and not a tumor, right? But having not known that was there, right, it could at some point grow, turn into a tumor. But now that I know it's there, I'm more diligent about, hey, every year I'm going to do a scan of the pancreas, make sure that that cyst is staying 2 millimeters and staying a cyst and not growing beyond that. And if it does, we'll catch it early enough that I can actually take action. And that's the thing. I think, like, you know, everybody hears pancreatic cancer like it's a death sentence. Well, it's because there's no symptoms, and by the time they catch it, it's stage 3, stage 4, and then you're toast. What do you think, Teresa, is the biggest misconception people have about the full body MRI?
I can chime in. I would say, and this is maybe a little like outside of the box as far as misconception, but I think the misconception is with the client that says, I don't want to know. Because I can guarantee my next, paycheck that if we fast forward time and you're in a hospital setting and you are, passing away from some cancer that was preventable or treatable at a certain point, I guarantee you would want to go back in time and find out earlier so that you could treat that.
Yeah.
You could be around for a longer period of time.
My ignorance is bliss, people.
Until it isn't.
Until it isn't, exactly.
And that's fantastic because you have the authority to make that statement. You've been in the hospital. You've seen people on their deathbed. Like you've witnessed the other side of it. And it's scary, right? I was nervous knowing that, my dad was diagnosed with cancer at 40. And so in my head, I've always had this ticking clock of like, time's running out. Here it comes, like 40's coming up. And so I did my scan at 39. I was like, man, as the day got closer that I was scheduled for the scan, scheduled for the review, like all in all, I'm healthy. My dad looks like me, very healthy as well. And I was just like, man, it's scary and terrifying if I have to go through what my dad went through, relive the trauma that as a kid, I went through, watching him put my kids through that. But at the end of the day, right, I'm very glad that it was, even though my dad didn't have a preventive MRI, 30 years ago, I'm glad that he got treatment and is here today. And, I wasn't fatherless at 13 years old.
Right.
So it's tough, and I get that it's scary for people, but they have to encourage a little bravery, right? Like, see what's going on. If there is something and you catch it early, it's treatable, right? And I think that's maybe another misconception that I see, that people think that, like, hey, if we find, maybe that's why they're scared. Like, if I find something, it's a death sentence. Like, no, if you find something before you have symptoms, the likelihood is it's stage 1, stage 2, very treatable, right? Very high survival rate. Like, that's what we want. If we're going to find something, we want to find it early, and that's why we're doing this scan in the first place.
I've heard many times in my career, and you just meet people and learn about people, and you will often hear people talk about somebody that they know that they were perfectly healthy, they went to the doctor, they were diagnosed with cancer, and within a month or 2, they passed away. So there are cancers that you will not know about them unless you are looking for them, unless you have an idea of what to look for and why to look for it. And I think doing the MRI and looking inside of your body and making sure that there's nothing going on that's, out of whack, is definitely a solid investment for your future and for your relationships with all of the people that you love. I forget on the last time I heard this, but somebody said it recently in the clinic that healthy people have lots of problems. Unhealthy people have one problem. So if we can help people eliminate having that one problem at some point in their life, that's something that I'm proud to offer to people to find those things.
Yeah, it's a blessing to have a lot of problems, right? And health
Right.
not be one of them.
Yeah.
Any thoughts come up in terms of like the misconceptions that people may have about BodyView?
No, I think that's a great one. And we've had tons of clients where it's, I looked into this, but I didn't really think about it. And then my mom's best friend dropped, dead of an aneurysm. So now it's like, mom's getting scanned, daughter's getting scanned, friend of the mom. And like sometimes it's unfortunate, but sometimes it is the one unhealthy person that pushes the healthy people to think that way.
Well, it brings it to the forefront.
Exactly.
It
That it
stinks.
can happen to anybody.
It stinks that's the way we are as humans. Like sometimes it takes
Exactly.
something in our life taking us and shaking us and saying, wake up, this
Right.
is important. Like, and again, not saying just for BodyView or other diagnostics or health stuff, but everywhere. It's like, sometimes we need to take that step back, recognize what's important and prioritize.